showed that the white blood cells, red blood cells, and platelets were normal. He had normal hydration. His liver, kidney, and electrolytes were normal. He did have an elevation of amylase, which is a pancreatic enzyme, and it can be elevated because of inflammation of the pancreas or inflammation of the intestines. So the upper end of normal is 1,100, and his is at 1,700.
Yep.
So I would say it's moderate elevation. And so, let's see. And with regards to his back leg, so after we sedated him, I was able to feel him better. And I definitely did not think that there were any evidence of fractures, and his joints feel pretty good. So right now I don't have a good reason to why he's not walking around, and it may be secondary to his gastroenteritis, so inflammation of the stomach and the intestines causing him to not eat and be lethargic. It's possible that it's related to the elevation of amylase. If a patient has pancreatitis, it can be painful. So if you wanted to, we have two options today. One, we can admit Hector into hospital for supportive care and get an abdominal ultrasound tomorrow in hospital. And from that ultrasound, we'll be able to evaluate the stomach, the intestines, the pancreas, and the rest of the abdomen as well, and determine if he has disease with the pancreas. With pancreatitis, they sometimes need to be in hospital because it's painful, and there's also times when they can do okay with outpatient care, so sending home with medications. So that's option one. Option two is if we did not pursue the abdominal ultrasound and send him home today with pain medications and see how he does at home. I'll also send him home with an anti-nausea medication just to help with his appetite.
Now, are you sure about this pancreatitis?
So the elevation is not definitive for pancreatitis, but it does indicate some kind of disease in the abdomen. I wouldn't say it's a very severe elevation. There can definitely be false positives as well. Yeah.
Well, I videotaped him, so I watched how he walked up and down stairs. And I know my cats better than I know my children. And, for him not to be able to use his back legs like that, the two films that I just watched show that. I had pancreatitis twice, so I know how it is in humans,
Okay. Yeah.
All right, so you think that there's nothing you can do for that except for medications, right?
We'll try medications. If he was in hospital, the goals would be to supplement him with fluids and adjust his pain medications until they're comfortable, give them anti-nausea medication. So the only difference in hospital and at home would be the fluid. Yeah.
Yeah.
Dr. Pike.
Okay.
Hi. So I put together an estimate, and this includes the exam, the blood work that we've already done, medications in hospital, fluids, a catheter, hospitalization, the ultrasound tomorrow, and possible medications to go home. So we are looking at around 1,500 to 2,000, and this is for 1 to 2 days. So certainly if he does okay tomorrow and we, reevaluate him and he looks better, then he can go home. Otherwise, I've just put up to 2 days just so we kind of know where we're going. Sorry, one more time?
I say, are you saying that if he stays in for 2 days under your care, you'll be able to know for sure that that's what it is and make some progress on it so he can be cared for at home?
Right. Yeah, so I can't guarantee that he'll get better, but most likely, based on his signs, I am confident that he will definitely benefit from the plan that we have right now, especially with pain medication, and getting the ultrasound tomorrow to rule out more severe disease and make sure that it is really just mild inflammation of the pancreas and kind of determine the extent of disease.
Okay. How long would you keep him in?
How long?
Yeah, well, I was in for pancreatitis, and it took 7 days.
Yeah. So in cats, it's less likely they're going to be in here for this long. For dogs and cats, for pancreatitis, they usually stay in hospital between, I'd say, 1 to 4 days. That would be typical. And rarely they stay up to 4 days.
All right, so if he doesn't have the pancreatitis and he has something else and you can wipe it out, we're in better shape financially, right?
This would be kind of the beginning. This include I put in a pretty good buffer just so you'd be prepared. I'm not too sure what else we would be able to find, and what the prognosis and kind of cost of treatment for those things would be. Right now, it's still quite vague, and there's only one elevation, so doing the ultrasound will be appropriate. But I'm not really able to predict what we would find beyond that.
Yeah. Well,
Yeah, it's a very thorough investigation, like imaging modality. So I'm confident with the test itself to do the ultrasound.
yeah. So you probably have a more fine-tuned diagnosis by Friday.
I would say by tomorrow. Yep, tomorrow we'll do the ultrasound and we'll have some more information.
Well, feel free to call me at anytime.
Yeah, so tomorrow a day doctor will be giving you a call, late morning, early afternoon, to let you know how he did and then what the plan is for the day.
Okay, that sounds good.
Yeah, yes.
Now, how's Hector resting? He looking all right?
Sorry?
Is he looking all right? He's my family.
Yeah, he's looking okay. I did have to sedate him, so he's just resting right now, which I think he's a little bit more comfortable, so I'm glad.
Yeah, that's okay. He could use a rest, yeah.
Yeah.
All right. Well, I'll look forward to those phone calls, and we'll see how it progresses.
Yeah. No worries. So tonight, we'll just have to, unfortunately, we do need a deposit of the lower end. I can adjust it so it's a little bit lower, but I'm not sure if you'll be able to put an estimate down. It's 1,400. I'm just adjusting it right now so we can.
Yeah,
Okay,
you guys can buy my 5 grandchildren some gifts.
So someone will give you a call, and at that point, you guys can sort out the paperwork first, and just let them know to call you in however long, and you can sort the payment out. Okay.
Okay. Thank you very much.
All right. No worries. Thank you so much, Charles.
Okay.
Talk to you tomorrow.
Thank you.